For a long time, when patients were harmed due to accidents in healthcare, it was assumed that it was an isolated event only occurring in that particular hospital. But over the last 10 years or so, it's been realized that many of the things that go wrong in hospitals around the world result from common factors.
Infections linked to healthcare affect and kill several million persons worldwide each year. Both viruses and bacteria are present throughout our environment, including hospitals, where they become contamination factors and thus constitute a danger to all patients. The reality of this threat was demonstrated by the Hungarian physician Semmelweis in the late 19th century. At the beginning of the 21st century, certain physicians and scientists aware of the cause highlighted the consequences of healthcare-associated infections. Each day in our world, more than 1 million persons suffer from diseases contracted in hospitals, and many of them die as a result. In 2002, the World Health Organization recognized the need for a global approach to healthcare quality and patient safety.
The vision that we had at the time was that it's such a big problem with so many different causes. We need to focus the world on the most important problem and something that's very actionable. So we came to the idea of hand hygiene.
And we wanted to have a flagship element, and that was hand hygiene. And we felt that it would be something that the healthcare professionals would understand, but also the politicians, but most importantly, the public and patients. Everybody knows that if you don't clean your hands, you're likely to transmit germs and disease.
The sources of healthcare-associated infections are multiple, but hand hygiene is always a key factor in prevention. A study published at the turn of the century in Geneva showed the absolute necessity of rethinking hand hygiene, so essential and yet so often neglected.
Washing your hands at the sink just took too much time. Time to leave your patient, go to the sink, turn on the water, apply the soap for 30 to 45 seconds, rinse your hands, and then dry your hands and go back to your patient. We needed to find a solution. We needed to change behavioral practices by healthcare workers.
In the United States, there was always a talk about hand hygiene being important, but nobody had done much to improve hand hygiene compliance for decades. Didier's work and others of using alcohol-based hand rubs made it clear that it was equally, if not more effective than cleaning with soap and water.
Das duas mãos.
Alcohol-based hand rub solutions soon found their role at the heart of a global strategy for the control and prevention of infections. This involved the adoption of new practices in healthcare, which required providing new tools to medical teams on an everyday basis. They included complying with a series of gestures, but also observing 5 essential moments in order to minimize any risk of contamination. These tools were disseminated by the WHO in numerous languages worldwide, grouped within a program titled Clean Care is Safer Care.
The tools are what make people apply the guidelines. That's what is unique about the WHO guideline on hand hygiene. It's not the guideline, because the guideline is 900 pages. There are 1,200 references. Who would read that? Nobody, right? So what we did is a summary, and then we did action tools that everybody understands and are using. You know the 5 moments, right? But you don't know what are the papers behind the 5 moments. Who cares about that? Only the experts. You see, that's the difference between guidelines, implementation, and tools for implementation.
Top priority has gone to actually implementing the program in the field. Resistance to the change has given way over time thanks to teaching and training. But the WHO was initially faced with cultural and sometimes religious barriers. The use of alcohol-based hand rub by Muslim healthcare workers required intervention from the highest religious authorities to validate these new practices. Alcohol-based hand rubs, today very widely accepted within healthcare institutions, are now also included within the kit carried by pilgrims travelling to Mecca.
It was very important that we got the religious leadership to give us a very clear directive that using such a product in the alcohol hand rub is not in contradiction with the Islamic tradition and culture.
Okay, let us start. You look at me, okay? 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5.
The global strategy has also been adapted to the needs of the poorest countries by facilitating generalized access to alcohol-based solutions. This challenge has been met thanks to the perfection of a simple formula for manufacture, exempt from any patent, using locally produced alcohol.
If you want healthcare workers to change their behavior, you need to make alcohol-based hand rub available worldwide at affordable cost. The challenge was actually not only to give the formulation, but also the recipe that goes with the formulation so that hospital pharmacies locally could prepare it at low cost.
Local manufacture is already taking place on several continents and is now effective in the regions of West Africa hit by the Ebola epidemic, which also underlined the vital importance of infection control. Since 2015, alcohol-based solutions have been included in the list of essential medicines published by the WHO.
Getting alcohol-based hand rub on there as one of the things that every single country should provide and have access to its population, legally, statutorily, regulatory-wise, it's a very, very big step. And so it was something we only started relatively recently, but getting it on there now means that alcohol-based hand rub has the same status as some of the other most important medicines in the world.
A lot of attention has been focused on improving hygiene, improving hand hygiene, but also other infection prevention and control practices as one of the most important pillars for preventing and also controlling outbreaks, including Ebola in particular.
Activities to encourage global health and infection prevention have been supported by private companies thanks to Private Organizations for Patient Safety, or POPs, an innovative structure set up by the World Health Organization to gather together manufacturers of alcohol-based formulations who are willing to uphold the strict recommendations of the WHO program. Clean care is safer care.
I knew that it was going to have a big impact around the world, and that's why I was so passionate about doing it. That's why I kept going when people said, no, there's many other things to do, it's not just about cleaning your hands. But I absolutely believed that we could make a difference and that we could change things.
Across the world, almost 150 countries have signed the WHO pledge, which commits them to promote these good practices on an everyday basis and also mandates them to acknowledge the existence of infections within their own healthcare systems. More than 20,000 healthcare establishments in 180 countries today actively participate in the Clean Care is Safer Care campaign. Their efforts rely on evaluation tools such as the Hand Hygiene Self-Assessment Framework, and each year the achievements of health institutions throughout the world are recognized by the Hand Hygiene Excellence Award. But above all, there are specialized teams and services in infection prevention and control who are working day by day to promote these good practices and tailor the global strategy so that it can be adopted by the greatest number. In 2009, a hand hygiene dance was even created. Adapted by hundreds of different countries and cultures, it spread right around the world.
You should never do infection control to make it a sort of a set pattern. Because you always have to put on your mind, and we always say every healthcare workers should never remove their risk assessment mindset. You go to a situation, you need to know the basic principles.
If we're going to be effective, if we're going to convey the right messages to stimulate the right actions, we need to be using the right approaches that will turn on the next generation. We have to look to the future if we are to sustain the improvements that have been made nationally and globally.